Well, I'm Dr. Michael Humphrey. I'm the Medical Director for Occupational Health Services here at Mercy St. Rita's in Lima. Occupational medicine presents a very unique practice setting for us here at St. Rita's in that we typically deal with three aspects of the patient's care. First and foremost is making the right diagnosis and taking care of the patient's medical issue, and making sure that we put their outcome and their wellness as paramount. Secondly, though, being occupational medicine, we deal with the employer on a very intimate basis to help mitigate their concerns about the patient's injury and to try to get the patient back to work as soon as possible, even if sometimes that requires restrictions, or if they can't accommodate restrictions, try to get the patient to a point of being able to perform some duty at work. And then the third aspect that we deal with, a little bit different sometimes in other parts of medicine, is a very large amount of bureaucracy and a large amount of legal regulations that we have to work with, since these are work-related injuries. So we try to balance all three of those entities here at the Occupational Health Center. So a patient that comes here for care due to a work injury is going to experience a normal triaging process. They're going to be going through filling out appropriate forms to document when and where the injury occurred, who they worked for, what the conditions of the injury were. Then they'll be brought back to a treatment area, and from that standpoint, it's very similar to other practice environments then. So that's kind of the nuts and bolts of what we do for a work injury. At the Occupational Health Center, we also serve employers in doing pre-hire physicals, drug testing, special surveillance programs such as vision, hearing, pulmonary function testing, and a multitude of other things that are sometimes based on the specific employer's needs. We also work a lot with third-party agencies such as Ohio Bureau of Workers' Compensation, legal entities, and helping patients get their cases approved if that's necessary, and then working with, I mentioned, as many of the legal regulations that we have to in the world of workers' compensation. The occupational health at St. Rita's serves a 9-county area. Obviously, the surrounding 2 or 3 counties that we are closest to are our primary service area, but we frequently do see engagements from the surrounding 6 counties that are further out. So we serve about a 9-county primary service area. So that's kind of nuts and bolts of what we do here at St. Rita's Occupational Health.